The disease that I'm presenting on is hepatocellular carcinoma, known as HCC. This is liver cancer. Okay, in order to understand HCC better, we'll go a few cancer basics. Cancer is uncontrolled mitosis, and so the cell is actively proliferating without listening to those checkpoints that are usually in place. This occurs through oncogenes as well as dysfunction of tumor suppressor genes. Oncogenes result in a gain of function of normal cellular processes, similar to having a brick on the gas pedal. The cell is just amped up in its normal processes to doing something excessively and too excessive, causing cancer. Tumor suppressor genes are usually regulating and preventing certain oncogenic processes from occurring in the cell. But if we inhibit or mutate a tumor suppressor gene, it will no longer be able to regulate and put the brakes on certain processes. And this is similar to losing the steering wheel or losing the brakes. The cell is unable to put the brakes or to regulate certain processes. It starts with normal cells undergoing mitosis as it normally does. Mitosis is a risk factor for mutations, and any type of mutation may occur. Some may not have any effect, some may have an effect, some may result in oncogenes or inhibition of tumor suppressor genes. And this leads to the cell becoming a little bit abnormal compared to earlier. Let's say this abnormal cell undergoes more mitosis and then more mutations occur, leading to further oncogenic processes or dysfunction of tumor suppressor genes. And this progresses and it may lead to mutations that make this cell more fit to survive than normal cells, leading to malignancy. And the cell may take away the resources of its neighbors that are normally functioning and will become cancer. Cancer is known as a disease of the aging. It does affect younger patients as well, but it significantly affects those who are older. This is because the more cycles of mitosis that occur, the more opportunities there are for mutations to arise. This is a normal tumor suppressor gene. Make sure it proceeds without damage to DNA, or make sure that it'll only proceed if the cell has enough resources. With this regulation, the cells are normal, and apoptosis occurs with abnormal cells. Same thing here. There's a normal proto-oncogene. It's not an oncogene yet. It's not ramped up right now, and there's no excessive proliferation or excessive oncogenic process. Now, usually in the S phase, most of the mutations occur, and with making a copy of all the chromosomes, there are more opportunities to have mutations. So let's just say that in the S phase, the tumor suppressor gene became mutated. Now this tumor suppressor gene is unable to regulate this cell cycle. Even if the DNA's integrity is not intact, or if the cell does not have enough resources, the cell's just going to continue on through mitosis. It's not going to care of if it's ready or not due to the loss of function of this tumor suppressor gene. And then this will lead to cancer. Similarly, let's say that during this phase, this proto-oncogene's mutated, turning it into an oncogene. It now has a gain of function. It's ramped up. Its function is super ramped up. It's going to do whatever it does excessively, leading to cancer. So cancer there is mostly influenced by environmental factors, and the influence of environmental factors outweigh the influence of hereditary factors. Cancer could occur in several different cells of the body, and that's how it is named. Since we're talking about hepatocellular carcinoma, this HCC disease is going to start with cancer affecting those epithelial cells. So it's called carcinoma. breaking it down, hepato means liver. Carcinoma, again, is cancer affecting the epithelial cells first. And so HCC is cancer of the hepatocytes, cell cycle disruption of hepatocytes, which are liver epithelial cells. It is significant to study HCC since it is the second leading cause of death worldwide. Risk factors of HCC are very related and influenced by environmental factors, as stated earlier. And a huge contributor is chronic liver infection by hepatitis B virus or the hepatitis C virus, as well as chronic alcohol intake for several years, ingesting aflatoxin B1, which is a toxin made by Aspergillus, as well as metabolic dysfunction. So all of these risk factors could lead to liver damage. So hepatocytes in the liver are damaged, and now the liver is in chronic turnover and chronic inflammation. Since the hepatocytes are damaged, the mitosis will be ramped up to replace those hepatocytes. So if you increase the mitosis that's occurring, we also increase the opportunities for mutations to occur. And let's say these mutations that occur eventually happen to be oncogenes or inhibition of tumor suppressor genes. This could lead to cancer. So a common contributor to the development of HCC occurs through telomerase reactivation. And this is through HBV inserting itself into the DNA of the host. And HBV tends to like to insert itself into the TERT promoter of the host. And the TERT promoter is the promoter that regulates telomerase expression. So HBV will insert itself, disrupting this TERT promoter, and this makes the TERT promoter more favorable for transcription factors to bind to it. Once transcription factors bind to this TERT promoter that's mutated, this will increase telomerase expression, leading to immortality. Usually telomerase is turned off in mature cells, especially hepatocytes, but HBV inserting itself will actually turn TERT promoter back on. Another key method of HCC pathophysiology is chronic inflammation, especially through the nuclear factor kappa B transcription factor pathway. And this happens to increase proliferation, allow the cell to escape programmed cell death, and promote metastatic processes through anchorage independence and contact inhibition. So pro-inflammatory stimuli, those environmental factors like alcohol or chronic infection, metabolic dysfunction, will promote these macrophages to express these pro-inflammatory cytokines. And these pro-inflammatory cytokines, which are outside the cell, will signal and activate a cascading pathway within the hepatocyte in the cell here. And this activates IKK. IKK is a protein that will phosphorylate IKB here, the red box. Phosphorylation of IKB will release IKB from this blue object, this blue molecule, which is the transcription factor NF-kappa B. Release of NF-kappa B from IKB will free NF-kappa B to go into the nucleus. It's a transcription factor, so it's going to bind to a DNA promoter and promote expression. And NF-kappa B happens to be a transcription factor promoting inflammatory processes that actually promote carcinogenesis. So through COX-1 and prostaglandins, this promotes cell proliferation and anchorage independence and contact inhibition. It allows the cell to detach from its neighboring cells and even the basement membrane, and it can flow into the bloodstream and go to other organs, causing metastasis. BCL2 is another protein, and it promotes the cell to have even better tools to survive and escape programmed cell death. MYC promotes cell proliferation. So these are really nice tools for the cell to become cancerous. Signs and symptoms of HCC include abdominal pain, jaundice, which is yellowing of the skin, and jaundice of the eyes known as scleral icterus, weight loss, malaise, which is generally not feeling well, and anorexia. Some signs on exam would be hepatomegaly, so enlarged liver right here, ascites, which is fluid in the abdomen. Labs may show elevated bilirubin, which is a pigment that causes this jaundice, as well as increased liver function tests. Ascites is known as fluid in the abdomen. Since the liver makes albumin, albumin allows the pulling of water or keeping water in the bloodstream. But if the liver is damaged from chronic infection, from HBV or HCV or chronic alcohol use, it cannot make albumin as well as before. With decreased albumin in the bloodstream, albumin will be unable to pull the water into the bloodstream. So water is going to seep out, leading to this swollen belly or ascites. With the presence of albumin, normal levels of albumin, the bloodstream, the blood vessels act hypertonic to the surrounding interstitial tissues. Now, without albumin, so there's no more albumin here, the blood vessels will act hypotonic to the surrounding interstitial tissues, and so water is going to leave. Okay, that's all. Thank you so much for listening.